Hi everyone, Dr. Cary here. Today we're talking about spinal stenosis. And spinal stenosis is one of the most popular topics that we've done on YouTube. We've had tens of thousands of views on this video over the years, and we want to bring you up to date on what spinal stenosis is and what we can do about it in the clinic. So spinal stenosis is a narrowing of the spinal canal or the nerve roots where the spinal cord and the nerve roots go through. And so in a healthy spine, the nerve flow goes from the brain down the spinal cord, and then it exits the spine on the left and the right through these holes called foramen. And in spinal stenosis, this nerve flow is affected. So the nerve flow going down the spinal cord or coming out of these nerve roots can be pinched, and the nerve flow can be diminished. So we see that when there's a herniated disc and the material is pushing back on into the spinal canal called central stenosis. We see it when there's a disc that's getting squished and pressing on the nerve root. We see it when the bones are breaking down and bone spurs are forming, and that pushes into the canal or onto the nerve root. And we see it when there's facet joint hypertrophy where the bones connect. That area is breaking down and it's pushing into the onto the nerve root or into the spinal cord area. So there's different reasons for it. If the spine's been out of alignment for a long time, if the posture's poor and the soft tissue, the disc material, or the bone is starting to break down in a case like degeneration or arthritis, then that can start to affect the nerve flow going through, and then it can result in symptoms. So what are the symptoms? Well, the symptoms really depend on where the nerve flow is being interrupted. So let's say you had a lateral stenosis up here in the neck. So the nerve root coming out of the spine was being pinched. That would affect your arm. You could have numbness and tingling in your arm, weakness, could feel cold or really hot. So it could change the sensations in your arm. And let's say it was happening down here in the lumbar area, in the low back, and that nerve root was being pinched and affected going down your leg. That could cause a condition like sciatica, where the nerve flow wouldn't get through, and you could feel numbness and tingling in your toes, weakness in your leg, problems walking, so and pain and discomfort. So that could be caused by pressure on the nerves coming out of the lower part of the spine. The nerves also go to the organs. So let's say that there was a blockage here in the middle part of the spine that could affect the organs connected to that area, or even down the line if it was enough pressure on the spinal cord itself. So really we want to identify when you come into the clinic or someone's referred to us, what's causing their symptoms, where is the stenosis, and we want to do a history and an exam, take some digital x-rays, and then determine what we can do to help that patient. So what can be done? Well, as a chiropractor, we want to realign the spine as best as possible. And by getting the proper posture and alignment, that'll open up the spaces between the bones so that the nerve flow can get through, and for the spinal cord to send the electricity from the brain to other parts of the body. So that's our goal in the clinic, is realignment and restoration of the posture and the nerve flow to the best of our ability. So we want to do as much as we can for the patient to restore their function and the alignment. What can you do at home? Well, once we start working on the spine and realigning it and improving the posture and the function of the spine, doing the exercises and stretches we give you, paying attention to your posture, improving your posture, giving your body the right amount of nutrition to heal the tissues, enough rest, physical activity and exercise. And this all depends on your specific condition, but you can do a lot of things at home to maintain the work we're doing in the clinic and have a good long-term outcome. Follow us on social media. We're on Instagram, Twitter, and Facebook. So follow us at Dr. Cary Yurkiw. And you can also follow us on YouTube. So if you're watching this on YouTube, subscribe to our channel, like this video. And then we have a podcast as well called Super Healthy on Android and Apple. If you're interested in coming to the clinic, we're located in Kelowna, British Columbia. And I'll put a link in the show notes below. You can click on that link and then schedule an appointment to come into the clinic and get checked. If you have any questions, feel free to leave them in the comments, whether it's on social media or here on YouTube. And I'd be happy to check the comments and the questions and respond as best as I can. If you're not in our area in Kelowna, be happy to send you to a chiropractor in your area that can help you with a condition like stenosis.